Well, I think a couple of things. It has to start with conversations with the families and with the community, and some education on what kinds of screening tools are best. The next step, if it's a population-wide screening, is we have to make sure that the resources needed are in place. So, for example, if we were going to do a depression screening in a population of several hundred students, there would need to be a lot of planning to ensure that we had all the resources in place to respond to every identified student's need. And the other part that I think is one of the great opportunities is that we can talk about how we would take the needs that we find in the whole population and maybe develop some interventions that would do prevention work. And one of the things that we know is that there are a lot of social pressures on families. And so looking for the other things that are creating stressors that are causing the pressure on mental health systems and also on us as populations would be great. The other thing I think that's really important to think about is to see this as a chance to go from just identifying a problem to creating interventions and, at the end of the day, prevention, because that's what public health is all about. As far as looking into costs and the possibilities of doing population-based screening, we've done a lot of discussing that issue in Cincinnati, and one of the greatest concerns was being sure that we had the plan in place to be able to respond to the number of positive responses that we received. The other is, can you use an electronic tool? Obviously, that becomes a little easier in terms of having all the data come together. And so there are multiple steps in the process. There are cost considerations, there are workforce considerations, there are scheduling considerations, and there is the whole issue of being sure that you're prepared. And I think that's the bottom line. When you do a screening tool that includes risk for depression, you've got to be prepared then to have a full response that identifies and can be sure that every single student that identifies a concern gets prompt access to the mental health services they need to ensure their safety.